How does a physician come and do so many first things? The first one to be asked to be a spokesperson for a breakthrough technology. The first physician who's that I've known, and you might know somebody, but there's this physician that's trained in 3 different countries, a vascular surgeon, and then he's written books, articles, but then also the first one to inaugurate an International Vascular Access Symposium. It just every time I see him, every time I see him, he's doing something new and different. I've met him in Paris, and he's the most humble person, just so smart and really good on camera. Let's talk to him about how he does that. Let's get inspired by learning from others who have done it so that we don't have to feel stuck and we can grow ourselves. We can dream bigger. Without further ado, I'd like to introduce to you Dr. Alexandros Mallios. Hi, Dr. Mallios. Thank you for being here from Paris.
Hi, Elsie. Thank you for the invitation. I'm very honored, and I'm humbled from all the kind words you're saying for me. I'm not sure if I deserve everything, but I'm very grateful. Thank you.
Yeah, so Dr. Mallios or Alex, I'd like to just tell everyone a little bit about you. Dr. Mallios he's a vascular surgeon in practice, and he's done so many different presentations and written books, and he's been at the forefront of the cutting edge technology that I've been talking about on podcast recently on the Ellipsys device. Was approached by people in the U.S. to be the spokesperson. Was on camera doing these procedures live for the first time from Paris. And what's different about Alex is that he trained in Greece as a vascular surgeon. I mean, sorry, as a general surgeon, then went to Paris for his vascular surgery, then came back to the US to then do more training at the University of Oklahoma, and now is back in Paris. So tell us, um, Dr. Mallios, Alex, tell us about your background and how that has really shaped you as a person and a physician.
Thanks, Elsie. So, it's all a combination of having ambitions, trying to get the necessary training, and also, of course, being hardworking and never saying no to any opportunity for training or any challenge. But also, I think that sometimes you need to be a bit lucky. You need to be at the right place at the right time and meet the right people. For me, it has been key my fellowship in Tulsa and the fact that I met Tip Jennings, and he became my mentor and my friend. It's like my scientific father, I would say. I have a very strong relationship with him, so, and he taught me so many things, and he has been key in my personal development.
Wow, that's interesting. What specifically do you remember him teaching that has kind of stayed with you all these years?
Well, there has been lots of technical things, like the proximal radial artery, and how this is a great combination, and how this is better from the distal fistula in some ways, and much more safer from a brachial artery fistula in other ways. But most importantly, what I learned from him, it's his way of dealing with things. How humble he is, how thorough he is. He became kind of like a role model for me. I said to myself, this is how I would like to be. When I'm older, and how I want to see people seeing me. I would like people to love me the way I saw patients loving him.
And you know what? That's how I saw you when I went to Paris and met you for the first time, Alex. I was amazed how your staff loved you too, and your humility, I think, brought more respect out of people than we as physicians when we come out of training. I feel like we weren't taught how to communicate in the way to engage our employees. Sometimes it's the reverse of what you think.
I think Elsie. I've thought about it many times. I think lots of what's happening with physicians, especially in the early stages of your career, has to do a lot with insecurities, I think sometimes, being a bit insecure about your experience, about your knowledge, having some negative thoughts about yourself, you're reflecting things to other people, and this sometimes might create some hostile situation, some words that might be exchanged, and sometimes, creating some tension that shouldn't be there. I think trying to avoid this kind of negative thinking about yourself sometimes, and understanding that we're all there to work, and everyone has his problems, personal problems potentially, and just trying to go on with the day and do what you're there to do, treat the patients, and try to be nice with everybody. I think it's always very helpful.
I'm sorry about that. Yeah, so thank you so much. What about how did you bring on opportunities? It just seems like people recognized you, Alex. Did you go seeking for that, or it just happened to you that, for instance, Mark Richard from Avenue Medical reached out to you and said, "You know what, Alex, I want you to be the poster child for our
Actually, not really. Actually, something that not many people know is that when I first came in Europe, in Paris, I had a first discussion with some guys from Avenue. And at that time, Avenue was hesitant because they were kind of waiting for the FDA approval. But, it's a startup, so the budget is small. And, they contacted me because, they knew about me from Tim Jennings. But at that time, there was no budget to pay for the devices, and they were a bit hesitant. So we lost 2 years, believe it or not. So everything that happened could have started 2 years before. So we lost a couple of years. And because Avenue at that point was essentially waiting for the FDA approval that was taking ages, after a couple of years, they got in touch again, and I said, give us some devices, and then we had some great results. We had a couple of ideas to modify the puncture, the technique, the dilatation, and they were excited about it. When they saw this volume of patients and the great results and publications we generated, this is what changed everything, basically. We kind of became in Paris the center of the technique. We were publishing a lot, doing lots of cases, modifying the technique, making it from 2 stages to 1 stage. And this really gave a big push to the company, and lots of buzz that created, with strategics that were interested to buy the company. And this, of course, is what gradually pushed me also to become kind of a spokesperson, because having a much bigger experience and also being a surgeon, which was differentiating me from Jeff, who was interventional nephrologist. Myself, I was a surgeon already doing fistulas. So the question was why a surgeon would create an ellipsis fistula, and I had arguments for everything. And also being a surgeon, this allowed us to be more aggressive, kind of balloon the fistulas more aggressively. We were our own backup in case you need to do superficialization, or if it wasn't a complication or something. So this was key in this development.
Right. Jeff Hull is an interventional radiologist. I just want to make that correction.
Yes,
But
sure.
yeah, so is it even other, I think vascular surgeons would be fearful in using a new breakthrough device. I know some vascular surgeons myself, and I've been around them a lot in the field that I'm in. So what is it about you think, that makes you brave enough to put in this device that's not been used in humans before, and then be able to modify them and try out even just different ways of doing it for the first time?
Well, I don't know if it's being brave. Of course, we need to be a bit brave or stupid. I don't know. Well, history will judge this. So a couple of things. First of all, we need to be fair with our colleagues in the United States. Things in Europe are still much more benign in terms of having issues with legal and being sued all the time, etc. So we don't have this extremely aggressive environment that you have in the States. It's coming, but it's not like that. I mean, there's no possible comparison. The other thing about, I think, when you want to be successful in these kind of things, it's not that you shouldn't be aware of the risks, but you shouldn't let the potential risk overwhelm you. I think if you start thinking about all the risk you're taking when you have a challenge in your life, you will never do it. If you think all the risks you're getting in an airplane, that you might crash or you might die or whatever, if you start thinking about the risks and you let it just overwhelm you and you're not able to sleep about it, and you will just never make it. For some reason, my mind setting, I guess I'm being lucky to be this way. I just don't think about it. I just think the objective. It's like I have a tunnel vision kind of, and I just see the objective. I kind of push away all the obstacles and I just try to follow my target until I achieve it. And I will be, as Tip Jennings was saying, for me, I'm like a dog with a bone. I'm just not gonna let it, and I will keep insisting until I make it. And of course, I also have lots of ideas, kind of technical ideas. I think this is, we are all gifted in different ways. Other people are gifted in, arts or politics or whatever, or in expression, or what you're doing about motivating people. I think I have lots of technical ideas. Sometimes they're interesting, sometimes they're not. This time it was interesting, I think.
Yeah, I think you made a great point. Is the point is what is your vision, and intentionally creating that big passionate goal that you want, and when you have that in the forefront of your mind, you are more able to overcome obstacles or overcome the fear of what's holding you back. And I think a lot of us as physicians, we take a job, we're in it for so many years, and we stop when we're not happy anymore, and then we don't even think about how we can even pivot because of the fear that holds us back.
Yeah. So there are a couple of things about this. So we need to separate whether we're not happy about the job, the core of our job, or the conditions and all the things around it. Yes. So if I think it's essential, and there's nothing you can change about it, being happy with the core of your job. Yes. So the core of my job as a vascular surgeon is operating and doing anastomosis and having a patient bleeding and fixing it. This is the core of my job, and I'm happy when I'm doing it. So when I'm in the OR, it's my happy place. Even if I'm tired, I don't feel tired when I operate. So that's great. So this gives me, I'm lucky, because I chose a job that makes me happy. However, if I feel frustrated because I come in the morning and the patient is not ready, or the nurse is not there, or anesthesia, was not there, or didn't want to give anesthesia to the patient, and there are, many things around the job that are frustrating me, I shouldn't confuse my actual work with the other conditions around my work. If you're not happy with your work, I mean, if you're doing an anastomosis and you find this is disgusting and you don't take any pleasure out of it, or yourself being an interventional nephrologist, ballooning a fistula, then probably you didn't choose well, and you should probably train yourself and do something else. But if there are the conditions around your work that make you unhappy, these are things that you can probably change. You may change the hospital, or you may try to speak with the leadership and see whether you can fix some of these things, with mainly organization issues. And very often these are organizational problems and communication problems and frustration because, COVID, or having more and more patients and less personnel. And, all these problems that are very common everywhere because we have a population that is aging and many more patients and less physician and, getting less well paid, et cetera, et cetera. But I think we should be able to see the two things differently.
Yeah, very, very good point. Thank you. Yeah. So, we hear a lot of physicians talking about systemic problems within the organization, and that's a whole nother topic. And this is a short podcast, but that's a great way of seeing it. And it's two different aspects of it. It's not just you and your love and your passion, but then the environment that you're around, and are you a part of that, and are you as a physician getting the skills and resources so that you can step up into that position to help other physicians and other healthcare workers live more at ease at work. with less of the issues that and processes and change management that needs to occur. So thank you for that, Alex. So as we wind down this short podcast, I want to ask you if you can give a tip that you think is paramount and that's something that you live by. I mean, you inaugurated the first International Vascular Access Symposium, which is going on. It's like you are constantly thinking outside of the box and bringing, who knows what other invention that you're going to be be in the forefront of. What is your advice to physicians who feel stuck and don't, I mean, you gave some really good tips now, but what is the number one thing you would say is somebody that maybe will get them start thinking outside of the box like you do?
Well, I would say that if you really love what you're doing and you feel confident about what you're doing and you like what you're doing, I think you should stick with it. You should keep on working like a dog. If you have issues, you should raise them appropriately without, raising the tone. You should raise the issues, and things will get better. Things will get better. Make sure you are within a team and you collaborate with friends. Try to get away from toxic people and toxic behaviors, and just don't let bad days convince you that this is the rest of your life. There are good days and bad days, and if you love what you're doing and you're a good person, things will definitely get better for you.
Great. Thank you so much. What can I share if people want to reach out to you, Alex?
Well, they can. I'm always easy to reach by email, and I'm happy to correspond with your viewers. And I thank you very much once again for your invitation, Elsie.
Thank you. Thank you so much for being on here. If you are a physician or a leader who has a story to help with physician leadership, please reach out to me at info@drlcco.com. And if you are also interested in getting leadership training for yourself, your colleague, or somebody you work with, please check out leadphysician.org. Thank you, Alex, for being on. I hope I get to see you in the States sometime or maybe at the next symposium.
Yes, absolutely. Looking forward. Thank you very much, Elsie. Have
Okay.
a great day.
Until next Sunday, everyone. Thank you very much.